Good morning. This is Mary Lou Novak with Resource for Care and resourceforcare.com. Resource for Care is an informational, educational channel for seniors and their adult children. So when you find yourself in a situation where you've gotten a diagnosis or maybe a hospital stay and you're not quite sure who to trust or where to get information, especially in the Memphis area, just go to our website, resourceforcare.com, and you'll see a selection of our educational videos. Today, we have two folks from Baptist Trinity Hospice and also connected with the Baptist Reynolds Hospice House. And we are going to, hopefully for you, dispel the myths of hospice and those misconceptions people have about what is hospice. So today we have Alyssa, who's an RN,
Yes.
and she's got quite a background in caring and working directly with clients as well. Do you call them clients or patients? Okay,
Patients typically, but
okay. So with patients as well as management. And then we have the licensed social worker, Tonya Wales, who is the administrator, correct? Did I get that right?
Yes.
Okay. So I often speak with families, especially with owning a home care business, and they really do not understand what hospice is. Do you find that to be the case?
absolutely. Yes, and that was one of the reasons we were excited to talk with you today, because we really want the Memphis community to understand what hospice truly is. And what are the advantages, and not to be so fearful of that word. I mean, how often do we hear that word hospice and we all immediately go, you know.
Right.
And so we were hoping to be able to sit down with you today and kind of talk through some of those things.
And we were talking earlier before we got on about some of the experiences. We had a few goosebumps going around. So hospice doesn't have to be scary, right? What would you say it jumps out as one of the I would say beautiful or nice experiences?
You know, with hospice, you are able to manage symptoms better. A lot of times, you know, the patients and their families have more time together once they enter hospice than what was previously thought would be the case. And it is because they're finally comfortable, their symptoms are well managed. And not only that, but the family can oftentimes take a step back and become the family again, as opposed to full-time caregivers.
Right. So when you said more time, I took it at first to mean more one-on-one time, but you mean length of life as well, right?
Right. It's not always the case, but you know, a lot of patients, once we get their breathing under control, their pain better managed, they tend to perk up a little bit, and they do, stay with us a little bit longer.
What do you think the top 3 myths are?
Well, I think the first one is that we often hear, oh my word, we heard the word hospice. The doctor mentioned the word hospice, and families automatically think that means maybe that death is imminent.
Yes.
And that is not the case. And in fact, when hospice became a type of care provided in the United States, and when it was Dame Cicely, when she created hospice and brought it over here from Europe, the intent was to be in that journey at the end of life. And by definition, we're a Medicare certified agency, and by definition, hospice is if a disease were to run its natural and an expected course, that a prognosis of 6 months or less would be present. But that doesn't mean that at day 6 month and a half that you're done.
Right.
It means that as long as you are in that course and the physician is able to continually recertify that is his belief, his or her belief, that if the disease runs its natural course, that we're looking at a prognosis of 6 months or less. And so what we want to do is we want to help families to understand, don't be fearful of that.
Right.
Because that 6 months could be beautiful, and the focus, instead of on going to treatment and going 3 days a week to dialysis or going to this or that. Could be
Right.
about getting together with the grandkids one more
Yes.
time at the beach.
Right.
Or taking mom back to her roots and letting her go experience
Yes.
where her family grew up in the homestead.
Yeah.
And we want it to be more like that. And it's about that journey.
Exactly. And with technology and all that's available to us now, sometimes the treatment is painful or
Absolutely.
I mean, there's probably other ways to describe, but that's what came to mind for me.
Well, we look at quality of life
Yes.
as opposed to the quantity of days.
Right.
Do we want those days to be beautiful?
Yeah.
And that's really what hospice
Yeah.
focuses. So that was the number one myth, I think, is
Right.
we don't want people to be scared that means that we're looking at a matter of days.
Yeah. When you said the word journey, that really cleared it for me, because I think a lot of care is transactional. Visit this doctor, take this medicine. What time is this?
Yep, it's a to-do list.
It's a to-do list. And what I eat, for people like with Parkinson's, my diet affects my all those things. But when you choose to make it a journey and then choose what that journey is, that's beautiful.
It is beautiful. It can be beautiful.
Yes.
Now, we also, I think sometimes we hear, well, that means I have to go somewhere. That's one of the other myths, is that
Right.
hospice has to be provided at a place.
Right.
And the hospice is not a place. Hospice can be provided in any setting that is home
Yes.
for a patient. I'd like Alyssa to talk a little bit about one setting because she knows our hospice house well.
Yes. So the Baptist Reynolds Hospice House is just this amazing building, and it is the patient's home. We make it as home-like as possible. Families bring little trinkets and whatnot in, but we truly treat it as this is their home. But it also gives the family an opportunity to have a break,
Yes.
and they can go home and get some rest.
Right. And know they're being cared for.
Absolutely. And of course, we have loved ones who stay at the bedside all day, every day, but we do try to give them the encouragement to take care of themselves.
Sure.
Because we cannot take care of anyone else
Right.
if we are not taking care of ourselves.
That's so true. I've been there. I've done, I think I mentioned earlier, I've done some volunteering there. When you walk in, to me, it's almost like a quiet, comfortable hotel.
There's a peace.
There's a peace about it. And what I like, too, is that there's areas that are dedicated to gathering, right?
Yes.
So tell me a little bit about that. What does that do for the families? Are they able to use that? Or
Oh, absolutely.
how do they use that?
Well, we've got several different areas. We've got a sitting area as soon as you walk through the main door,
Right.
and you can sit around and talk with your loved ones, before you even really enter the building. But then as you get farther in,
Right.
you have different little locations, and everything offers a little bit of a different scenery and vibe, if you will.
We have a chapel.
We do have a chapel that is open 24/7. And then a lot of families will actually gather around the couch, on the couch and
Right.
around the table that is at the nurse's station.
Right.
They like to feel kind of included in, we're two families merging into one.
Sure.
Right. And a lot of them do really feel at the end of their journey that they have gained a whole new family.
Yeah.
But yes, they will come out, and it gives them that opportunity to still be nearby,
Yes.
but taking that break for themselves.
Sure. And I would imagine, family comes from all over. So rather than gathering somewhere like at a home at somebody's house
Right.
and then making their way over, just the piece of
Right.
being able to be.
There's even a playroom
Oh,
at
that's
the hospice
wonderful.
house because you
Yeah.
have grandchildren
Sure.
or youngins
right,
that are coming.
Right.
Absolutely. They
beautiful.
get restless too.
Sure.
So,
And you want to be all inclusive. You don't want to say no children allowed.
Absolutely.
I mean, grandma and grandpa or mom and dad want to see
Mhm.
everybody. Yes.
Absolutely.
But you know, the myth though, I want to make sure is that people don't think they have to go somewhere.
Correct.
Yes.
So hospice can be provided in the home, and that home could be the adult child's home, or it
Yes.
can be mom's home.
Right.
It could even be a long-term care facility or an assisted living
Wherever
facility.
they call home.
Whatever
Yeah,
they call home.
absolutely.
And the other thing, and when I owned a home care agency, is that they still can work with, other caregivers besides family that help with the day-to-day
Right.
bathing or toiletring or whatever needs to happen.
Yes.
Yeah, in the home.
Mm-hmm.
Yeah. So it's a care team, I guess.
It does become
Yes.
a team.
Yes.
And we always say that the family is at the head of that team
Mm-hmm.
because we want them and the patient driving what that plan of care is.
Mm-hmm.
And we want to follow their lead on that.
Right.
And obviously, we also follow the lead of physicians. We
Yeah.
have a doctor that's driving the care, but ultimately, the patient and the family are the ones letting us really know what those goals are.
Sure. So we talked about, this is a journey. This is not the end. It's still a part of the journey.
Mhm.
And we talked about hospice being anywhere, at a space or in your home, basically wherever you call home. What would be a third myth that you could?
A lot of
Dispel
people
for us.
think that there's a lot of cost involved with hospice care.
Mm-hmm.
And generally, and I'll speak specifically to our Medicare population since we are hoping to reach
Yes,
older.
mainly seniors and older. folks.
Typically, with our Medicare and Medicare products, there's
Mm-hmm.
not an out-of-pocket expense. Now, commercial insurances sometimes there's a little bit different, but I do want to be really clear. So the Medicare benefit, if I think that Alyssa and I both could really speak into that, it does not provide around the clock care. And as you know from
Yes.
your time with your business,
Right.
it does not provide around the clock care. But what it does provide is it allows us to send in personnel into the home.
Yeah.
And that personnel is typically an RN. In my agency, it's all RNs.
Mm-hmm.
And that RN is a case manager. And the Medicare conditions of participation only require one visit every 2 weeks.
Oh, that's interesting.
But most of your hospice agencies, and something for your viewers
Yes.
to inquire about as they're interviewing agencies, is what should I expect that standard to
Sure.
be? My agency standard is going to be around 2 times a week.
Oh, okay.
And as a patient's condition warrants
Right.
it, we may increase to daily visits.
Right.
And so, and we will increase those visits as needed, even in the hospice house,
Okay.
will be more prevalent. But personnel, so you've got RNs,
Yes.
but then your team is also supported by certified nursing assistants.
Okay.
And so our agency only employs certified nursing assistants. Now
They're
I think
also
that's
known as
probably
their acronym, right? CNAs.
CNAs.
Just in case
Yep.
people are confused
And
by
that's
that.
and I
Yes.
think most agencies in Memphis are employing CNAs, at least with the agencies that I've been associated with in the past. And that is those individuals are going to come in and they're going to help with that bedside care. They're going to be doing bed baths and toileting and incontinence care
Sure.
and maybe feeding.
Yes.
They have probably the most special and intimate role with the
Yeah.
patients.
Yes.
They're there more hours and they're doing the intimate care.
They're very personal.
Yeah. Yeah.
Our care partners at the hospice house are they are the ones who know those patients the best, quite frankly.
Yes, absolutely.
And so you've got your personnel, you've got nurses,
Yes.
CNAs, and our CNAs for the most part you're going to look at about twice a week. There is
Okay.
not a Medicare COP that says how often.
How often?
So that's
Right.
another thing I think the viewer can inquire about.
Okay. So what's the standard practice of your agency?
Our agency is about
Yeah.
twice a week. Yes.
But that's the question.
Yes.
Yeah, is to be, what is your standard practice for
How often
hospice?
should I expect a certified nursing assistant to visit?
Right, right.
Yes.
And then the family can decide what kind of either other outside caregivers or
To
family
support.
caregivers to fill in the gaps.
Right.
Yes.
Yeah.
But then also you have licensed social workers,
Mm-hmm.
and I obviously I'm a social worker, so
Yeah.
but I will tell you what families don't realize is what that brings to their care team. So
Describe that for me, because I'm not as intimate with that.
yeah, so the social worker in the home setting and even in our facility setting is going to be the one who knows about resources that are available.
Okay.
Is going to be the expert on what your insurance would cover.
Okay.
It's going to help with funeral planning.
Mm-hmm.
Might help if a level of care change happens. So say you have your loved one at home and your desire is to keep them at home, but then you have a health crisis and you can't keep them at home
Right.
anymore. That social worker can help you find an alternative placement.
Okay.
The social worker is also skilled in counseling
Mm-hmm.
and can help with some things related to the loved one's decline that are happening in the home.
Right.
If there
Maybe
are
things they observe or
yes
struggles that the family share. Or,
yeah. Well, what about if there's young children
that's right.
and helping those young
Helping them
children
understand. Yeah.
to cope? Yeah.
That's important. So I know from having family members in the hospital and from the care, in the care agency, that there's always a case manager on the job. Everybody gets assigned a case manager. You mentioned case manager being an RN typically in your scenario, and to me that means they're more experienced. They've got a broader base, right, to draw from. What is the difference between that and the social worker then?
Do you want to address that as the nurse?
Gosh.
Is the social, because you mentioned that the social worker would know all the resources, but when I look at the hospital setting, I think of the case manager as that.
Right. It is very different than case
Yeah,
management in
so
the hospital.
help me understand the
Yes.
difference.
And I would always tell families on, initial evaluations or admissions to hospice. Sometimes you would see that they would get a little nervous when you mentioned, there's going to be a social worker, because not everybody understands the good that social workers do. And they
Right.
may have, that thought that, oh, do they think that I'm not taking care of
Oh,
my
I see.
loved one,
Right.
And but I would always let them know that this is an important member of the team that is going to have some answers for questions that you aren't even aware that you have yet.
Right.
As things progress, as we go day by day.
Right.
And so, but with that, the nurse is, I guess they would be the head case manager.
So they might be the more clinical.
Correct.
side.
Absolutely.
Okay.
But we work very, very closely. In fact, we all do, down to the CNAs. It's our interdisciplinary team,
Right.
And so really, we cannot do this without the assistance
It takes
Sure.
everybody.
of everyone.
How do you, I know I might be getting in the weeds a little bit, but I know because I also worked in a hospital, that, the nurses would have their weekly meetings with the case managers and talk about individuals and where they are in their care and how close they are to being discharged and, what happened this morning and you're going to take the baton this afternoon. How does that work as a team? How does that communication happen when it sounds like you're not all, if it's in the home, you're not all going to one place or you're not all there at the same time? That's the point.
So
Right.
part of the Medicare provision is that we do something called IDT or IDG.
Okay.
Different agencies refer to it differently,
Okay.
but it's an interdisciplinary team or an interdisciplinary group.
Okay.
Every patient has an IDT once every 15 days max.
Okay.
So we
Interesting.
meet in our agency, for example, every Tuesday and Wednesday. So that means that half of our patients get reviewed one week and the other half get
That makes
reviewed the
sense.
next week. But that meeting is conference room setting and all the disciplines are present.
Okay.
So the nurse case manager is going to come in and she's going to start by talking about the patient's overall condition.
Right.
But then she's going to also talk about the medications that she's managing, the equipment that she's got in place, the
Right.
supplies. Those
Right.
are all provisions. Those are all part of the hospice
Okay.
provision. Then the social worker may chime in with, well, let me talk about some of the family dynamics that are going on, or these resources that I'm plugging them into.
Right.
But we never even talked about there's also a spiritual component to hospice.
Right.
And so a non-denominational chaplain is also assigned. The families can choose not to have that part of the team, but we always encourage it.
Sure.
Because it is such a spiritual time. But so that meeting, to answer your question, is that full discipline.
Okay.
Even the volunteer program,
Yes.
there's a part of hospice that we can talk about if you want us to.
Yeah. I don't know how much time we have.
I don't want to extend too much, but so
About 10 minutes.
Okay.
well, volunteerism is a required part of the hospice benefit.
Required by
Medicare.
Interesting.
Yes.
That fact I did not
There are
know.
very few agencies in this world that require volunteerism.
That's interesting.
So for every hour that we have of paid employees, we must have 5% of volunteer hours. So if we have 1,000 paid hours, we have to have 50 volunteer
Okay.
hours. Did I get that right? That right math? And so we have a very vibrant volunteer program. We're always
Sure.
recruiting volunteers.
Right.
And the volunteers are treated as unpaid employees. They go through training, extensive training. They go
Yes.
through background checks, all the same. But why that's relevant maybe to your viewers is companionship.
Sure.
Being able to find, for example, a veteran who is on hospice service oftentimes would love for another veteran to come in and sit.
Yeah.
And so we try to do veteran to veteran volunteers.
Absolutely. Yeah.
Or maybe mom loved to do crossword puzzles, and we can find
Sure.
a volunteer who will come and sit
Yeah.
and do crossword puzzles with
Yeah.
her.
Yeah, we had they weren't on hospice, but he was a veteran. He was a Navy man, and he just loved to talk about the boats and the ships. They're probably bad to say boats, but probably ships. And we had a male caregiver, and they just
related
oh
to each
my
other.
gosh, they could relate. That's important. I didn't realize that. That's something new that I just learned. 5% of the hours
Of all
need to
employee
be,
hours
of all
must be
employees' hours
volunteer.
must be volunteer hours. Wow. So what is the you talked a little bit, I don't want to get too much into it, but with home care and other people coming into the home, everyone has a fear of who is this person coming in. So just a little bit about how you vet people, and how whatever you could say that would convey confidence that you're doing a good job of vetting these people.
The hiring and background processes across the board with all hospice agencies, because we are Medicare certified, are quite, and because we're licensed facilities, they're quite extensive.
Right.
Alyssa and I have worked between us for about 4 different agencies in our careers.
Okay.
And 5 agencies, I guess, in our careers, and they're all the same. There are extensive background checks. We check all the abuse registries.
Sure.
We check licensures to make sure those RN license are in good standing.
Yes.
The certified nursing assistants aren't, that no one's on the abuse registry.
Yes.
We're checking those.
Right.
We also do drug screening. We do, and so because we're licensed, we're also, our fingerprints are already on file.
Yeah.
That's part of my social work license.
Sure.
Part of a nursing licensure. Am I forgetting any component?
No,
No, I think you did it all.
A few years into the home care, because we were hiring people that were not licensed. CNAs necessarily aren't licensed, or caregivers, especially because we hired a lot of seniors to help seniors.
Right.
They're not going to go back to school and get a CNA.
Right.
But we started checking, even though it wasn't required, checking if they had ever been licensed, if they lost their license. Because you can be a professional, never have a criminal record, but yet have lost your license due to maybe mismanagement of medication or something like that. So, that gives peace of mind that there's such a stringent check on these folks that are coming into the home. Because it's a big deal when you're used to being independent, and then all of a sudden all these new faces.
Absolutely.
Well, and I think I'll say finally, because if I were on the other end of the camera, I would be interested in this, and that is, your Medicare certified hospice agencies are also surveyed regularly, and what that means is they come in and they actually review all of our processes.
Right.
They look at
I'm
our
familiar with
hiring
that,
processes.
because I was
Yes, you
licensed
do. You do.
Yeah.
But they go into our charting.
Yes.
And that is done actually regularly because we have to submit it for billing purposes. So there are some
And they've
really
gotten
good
pretty
checks.
specific about how they want you to report all of that. I know that's been a challenge.
Well, and your viewers can go on Medicare.gov and they can look at the scorecards for all of the hospice agencies in Memphis.
I love that.
And I would like to add as well that, you know, when a physician recommends hospice, you know, they feel like we've done everything that we can as far as treatment goes. You know, it may be time to switch the approach up and try hospice. They can recommend a hospice company. They can tell you the name of one. It is their decision on what
The family's decision.
It is the family and patient's decision on what hospice company that they choose. You know, if they have a nurse that comes in to do an initial evaluation and potentially an admission that day,
Right.
you know, if they just do not feel comfortable with
Sure.
what they are hearing,
Yeah.
you know, they can ask to hold off on the admission for today.
Yes.
And talk with another company if they wish. So it does not have to be a decision that's made by their physician.
Right. Right. Little plug for a group that we belong to, the Women in Senior Healthcare. We always say, if you know one of us, you know all of us, and there's probably a little over a dozen of us. So we regularly get correspondence, emails, whatever, from people in the community asking our opinion. Who do you recommend for this, or who do you recommend for that, and it's changes all the time because a lot of the care has to do with staffing. Tell me if I'm wrong.
No, you are right.
So one place can be, great 1 month and then go through a spell where they're challenged, but then rebound. So it's always good to check in with our Women in Senior Healthcare, and all of the members of that group are also on my website with how to reach them. So we're not collecting your information. We're just a resource to connect you with local professionals like these two ladies, and give you information directly from those who are on boots. I say boots on the ground,
Boots on the ground,
or clogs on the ground. I don't know. We nurses tend to wear like the clogs, right? Do you have? I don't know.
You know,
check your shoes.
as
Clogs
long
on
as
the
it's
ground.
comfortable for 12 hours, we got it.
She works 12-hour shifts, so yes.
I'll have to come up with a phrase. We'll have to come up with something
Yes.
cute, because boots just doesn't make sense with healthcare. We'll have to come up with something else.
Maybe sometimes.
Oh yeah.
All right. Well, we hope this has been informative, and check our other videos out by clicking on any of the links on the website, and you'll be brought right to my YouTube channel. And starting in June, we'll be on podcasts. So look for Aging in Memphis podcast.